I would also like to know, like, apart from children's, like, what are the other, diseases where you are prone to have, which affects eyes?
Okay, so the eyesight is basically affected by the most common and the lifestyle disease which so many of us have, or which so many of the people in the developing country like India have, is diabetes.
Diabetes.
Yes, the diabetes, the eye is one organ that is very highly affected with diabetes if the sugars are not under control. So when the diabetes, the duration of diabetes, if it is long, say for example when it is 10 years or more, when the the control is bad, or when the sugar range is very high, these are the three conditions which cause diabetic retinopathy. The diabetic retinopathy is basically the diabetes which affects the retina of the eye. It is called diabetic retinopathy. So that is very common in a developing country like India. To wear glasses. And there are lots of lifestyle modified conditions. For example, diabetes is a very emerging, and it's one of the so many people have.
I think patients are more prone to other diseases. I think diabetes keeps attracting a lot other diseases,
Yes.
inline diseases.
Yeah, diabetes, if it is not controlled, it basically affects three things. One is eyes. Eyes is the most important organ. It is affecting. Second is kidneys.
You mean to say that eyes is the most affected?
Yes, in diabetes.
Organ on diabetes.
Yes.
Oh my God.
And people tend to ignore it. They don't take a serious concern about it. Eyes, kidneys, and peripheral nerves. Basically, the end organs, those are the ones which are getting affected with diabetes. So, eye is another area which always gets affected. So, that is one. And second, when people cross 50, 60s, they tend to develop cataract. So then they'll have to undergo cataract surgery, and then they get back the vision back to normal.
This is something I'm very curious to know, because my mother underwent cataract surgery, and then suddenly I've heard that after cataract your vision comes back and then you are able to see. You don't even wear glasses. Like, how does that miracle happen at that age, at 60? People are, suppose if I wear glasses all through my life, and then suddenly if I have a cataract operated, then I get back my vision. So how does that get recovered?
Yeah, so usually like I said, for the kids, that's the time when they start wearing glasses. And the glass power keeps on changing every year, or probably 6 months. And for boys, it usually stops by the age of 22, 23. And for the girls, it stops by the age of about 18 to 20. So then the power remains stable. Yes.
Okay.
So that is the time when the power won't change, and they will be wearing glasses constantly. And after 40, you have the reading problem, and then again you'll have to add the reading power also for your existing glasses. But once you get the cataract surgery, we calculate the power of the glasses, and we put the lens inside the eye which has these power.
Okay.
So that is how they don't have to wear glasses after cataract surgery.
Okay, so in the cataract surgery itself, you put the lens, that power inside that
Yes.
eye retina.
Yes.
So you don't have to wear it.
Yes.
Okay, this was something I was missing, because I was very ridiculous to know. Like, I was curious to know. Sorry, I was very curious to know.
Gets cancelled.
Okay.
So that is one technology. And as I mentioned before, diabetes. So when the diabetes affects the eye, it's called the diabetic retinopathy. So when diabetic retinopathy happens, as you know, for diabetes, when there is an injury, it takes time to heal. The bleeding, if it happens, it doesn't stop. So similarly, in the eyes also, there are bleedings. So
in the eyes also there are bleeding.
Yes, in the retina, there are bleeding. So that is called diabetic retinopathy. So these bleeding, they don't tend to stop. If the sugar is uncontrolled, the bleeding will be so profuse, and then they suddenly lose vision. So there are lasers in which we do in the eye, in which the bleeding doesn't happen, or whatever bleeding has come, we burn them, so that in future the bleeding doesn't happen if the sugar is under control.
If the sugar is under control. And I think that is the most essential part. Even for a little surgery, you will have to get your diabetes under control. Only
Yes.
then people will go for any sort of surgery. Yes. So also, I think, does BP, blood pressure, also impact eye health? Because I remember a case where I had an aunt. She was traveling, and then suddenly her eyes were red, and then we went to see a doctor, and then they said that because the pressure has increased, and then that had led to eyes getting red. So how true is that? Like,
yeah, so when there is a high blood pressure, there tends to be a sudden burst in the blood vessel, and that is which is seen as a red color in your conjunctiva. That is called subconjunctival hemorrhage. That happens because of a sudden burst in the blood vessel. But those are like the bleeding which is seen outside. But there are also bleeding which happens in the retina or in the nerves.
Okay.
That also happens because of high blood pressure. So there are basically three diseases which are giving injury to the eye. One is diabetes, one is hypertension, and one is cholesterol.
Cholesterol.
These
Cholesterol is also impacting
yes,
eye health.
yes.
I thought cholesterol only like is impacting your liver and heart.
Yeah, so it's basically how does the cholesterol impact the heart? The cholesterol get deposited in the blood vessels, the blood cannot flow, and that leads to heart problems.
Yes.
Similarly, for the eyes also, the blood doesn't reach the eye, it gets deposited, and it leads to all these the block in the eye, and the patient.
Blockages in the eye.
Yes, so that is called central retinal artery occlusion, when the artery gets blocked.
And how can people know that something is happening with my eyes, such procedures?
They'll lose the vision. One fine morning, or when they're doing work, suddenly they'll feel that eye has become blackout. They won't be able to see anything.
Does that happen?
Yes, that happens very commonly. But what happens is, these people, the patients, they feel that after washing the eye, or after few hours, or the next day, it will become better. But that is one wrong thing what people are doing.
Okay.
Because whenever you feel something like that, it is mandatory to see an eye doctor as soon as possible.
So is there any early symptoms which people can notice? Because you're saying that one fine morning I'm waking up and then I see that I'm not able to see anything. My my entire capability of visualizing something has gone. So is there any early symptoms or early signs? Because body must be sending some early signs. Maybe people can get aware of.
Yeah. So like eye is also an organ in the body. So when you have a disease in your body, or when you have a lifestyle disease, for example, diabetes, hypertension, or hyperlipidemia, these three things also cause problems to the eye. So whenever you are diabetic, you always have to get your eyes checked.
Eyes checked.
Yes, when you are hypertensive also, you have to get your eyes checked. Usually, we would always recommend eye checkup to be done once a year.
Once a year, and for what age? Like after 40?
After 40, always once a year, if you are diagnosed with any of these. And usually people, there will be some alarming signs. For example, some might have floaters, something floating in front of their eyes. So when you see some floaters, or when you feel that your vision has reduced, or you feel that suddenly there is a drop in vision, but after some time the vision has come back, these are alarming signs when you have to visit an eye doctor.
You have to visit an eye doctor. So these are the three conditions I would say that you should start noticing, and if you feel that there are any such symptoms seen in your case, then you should also go and look for a doctor. Okay. Thank you so much for being on the show. I think my audience also came to know about so many things about eyes. And with that, I would also request everyone that you should also take care of eyes. Eye health is equally important like any other organ in your body. So thank you so much, doctor, for being on the show, and all the best.
Thank you so much.